Good day. I am going to make a couple more calls. Hopefully I can get the information that I'm requesting. Alert.
You're currently experiencing high call volume and high call wait time. If your request is not urgent, please call back at a later time. If your request is urgent, please wait for the next available agent.
So we're waiting.
If you're calling about benefits available from the government of
Who's
Canada,
watching? If you'd like to leave a message, that would be great.
Canada.ca/economic-response-plan to get more information. Again, that's Canada.ca/economic-response-plan. Please note that this call may be recorded for quality assurance and training purposes. Veuillez noter que cet appel pourrait être enregistré à des fins d'assurance de la qualité et de formation. Hi, this is Chris speaking. How may I help you today?
Oh, hi, Chris. This is Sophia. I'm phoning to find out who is it that dictates public policy. Like how does public policy come into being? Like I would like to know.
Ma'am, well, you're calling the 0'Canada, which is an information line for federal programs.
Yes.
I have the access to all the programs. I do not know them all by heart, so you're gonna have to help me here, ma'am.
Pardon? Sorry.
You're gonna have to help me a little bit here, though.
Okay.
I do not know who dictates public policy, ma'am.
So you don't know how public policy gets put into place?
I do not know, ma'am. I don't have a training for that. No. Maybe you can make a research online and you find that in regards to a program, I can assist you, give you information in regards to a program for public policy. But I do not know personally who dictates public policy, ma'am.
Okay. Thank you.
Thank you for calling. Have a good day.
Okay, bye. Well, that was interesting. So much for that. So I have to do my own digging. So I'm just trying to figure out how public policy gets put into place. Public policies, Canada.ca. So welcome, everyone, anybody that's watching me. I'm just doing a little bit of research. Corporate information. So contact. So, reporting abuse. Contact. Abuse. If someone is abusing you, like, do we report the government as abusive? Client Support Center for information on your citizenship or immigration status. That's not going to help. How do I report any behavior that scars, threatens, controls, or isolates you? Could be abuse. Oh, there we go. I shall make a call. We'll see where this takes me. What rabbit hole it takes me down.
Migration, Refugees and Citizenship Canada. Thank you for reaching out to us today. Bienvenue à Immigration, Réfugiés et Citoyenneté Canada. Merci de nous avoir contactés aujourd'hui. Pour le français, faites le 1. Please note that our menu selection has changed. Please listen carefully to the messages prior to making your selection. Please note that option 2 is for victims of abusive situations. If you are not a victim of an abusive situation and you choose this option, your call will be transferred, which can increase your wait time to speak to an agent. Client Support Center agents are available to take your call Monday to Friday from 8 a.m. to 4 p.m. local time. For information on how to apply, processing times and fees, to check the status of an application, change your address, and much more, please visit the IRCC website. Due to COVID-19, IRCC is experiencing processing delays, and we can't give accurate processing times for most types of applications. We are currently prioritizing applications from people who are exempt from travel restrictions. We invite you to continue visiting our website regularly as it is updated as more information is made available, and it provides information on how to check your application status. Please note that the Client Support Center agents can't give you more information than what is already available in your online account or in the client application status tool. We thank you for your understanding. Since January 7th, 2021, air travelers 5 years of age or older are required to present a negative COVID-19 test result to the airline prior to boarding international flights bound for Canada. This test must be conducted within 72 hours of the traveler's scheduled departure to Canada. More information regarding this requirement is available at travel.gc.ca. Please press 1 to provide your unique client identifier, also known as UCI. If you don't have one, please press 2. In order to better assist you, please choose one from the 4 following options. If you have questions about an application or candidate profile that was already submitted to IRCC on how to update your personal information or about replacing an immigration document that was lost or stolen, press 1. If you are a victim of abuse or to report abuse or fraud, press 2. For answers, please note that this menu option is for questions relating to domestic abuse, neglect, or any other type of abuse situations only. If you are facing family violence, you have options. To speak to an agent and learn about those options, press 0. To hear this information again, press 9. To return to the previous menu, press star. We are transferring your call to the next available agent who will gladly assist you. Your call may be monitored for training and quality purposes. To protect your personal information and to confirm your identity, the agent will need to ask you a few questions. Please have your application number or your client ID ready so we can assist you.
It's not going to help.
Bonjour, my name is Liliane. May I please have your client ID or application number?
What?
Puis-je avoir votre numéro de client ou de demande, s'il vous plaît?
Where do I create a client ID number?
Do you have any application with us?
What do you mean an application? Like, what do I need to do?
You have contacted Immigration, Refugees, and Citizenship Canada.
Oh, I've got the wrong department.
Okay.
I'm under. So where do I go to report fraud or abuse other than immigration? If I was born in Canada.
And abuse, is it related to any immigration case?
No.
Okay. You can contact Canada Fraud.
Canada Fraud. Do you have the number for that?
Yes. We don't have a number. Let me see if I have an email. I believe I might have an email. But it's not related to immigration at all.
No. I was born in, supposedly born in Canada.
Okay.
But where do I go for information about the birth? I'm not sure if you have the ability to answer me that. Where do I go to find out information about how the birth certificate is registered?
Oh, wow. That I don't know. It's more at the provincial level.
Okay.
So for Canada Anti-Fraud Call Center, I can send you the link to their website.
Okay.
So you can go from there. May I please have an email?
Oh, it's COVID, COVID, truths, TRUTHS, revealed, REVEALED, @gmail.com.
Okay, COVID truth revealed @gmail.com. Okay, perfect. Yep. I'll send you the email.
Thank you. You have a great day.
You're welcome.
Okay, bye.
You too. Bye.
There we go. So that wasn't very helpful. So I'm going to have to just send them an email. And it would be great if I could get some information as to how the birth certificate is registered. And who I inform certification and licensing is false because it's based in illegitimate. Well, they just, here I'm in Washington somehow. It's interesting. We can't even phone any of the offices of the MPs or anything. Like I can't even. There's not even a number for. Well, maybe I'll phone back the 0'Canada to see if I can get a phone number for them. That's what I do.
Thank you for calling 1-800-0'Canada. Merci d'avoir appelé 1-800-0'Canada. To continue in English, press 1. Pour continuer en...
We are currently experiencing high call volume and high call wait times. If your request is not urgent, please call back at a later time. If your request is urgent, please wait for the next available agent. If you are calling about benefits available from the Government of Canada related to COVID-19, please visit canada.ca/economic-response-plan to get more information. Again, that's canada.ca/economic-response-plan.
Please note that this call may be recorded for quality assurance and training purposes. Veuillez noter que cet appel pourrait être enregistré à des fins d'assurance de la qualité et de formation. This is the 1-800-0'Canada number, the General Information Referral Services for the Federal Programs of Canada. Alpha speaking. How may I help you?
Oh, hi. I'm not even sure if I got the right place or if maybe you can direct me. I'm looking for a phone number for Justin Trudeau's office,
Okay, what province and city are you calling from?
British Columbia.
We're in BC. What city?
Oh, city of Penticton.
Penticton?
Mm-hmm.
Okay, just so I understand you correctly, you'd like the contact information for Justin Trudeau's office.
Yes.
Right?
Mm-hmm.
Can I put you on hold while I find that information?
Sure. Just don't put any music on because that it's not very pleasant.
I wouldn't be able to control that. All I can do is put you on hold.
Okay.
Sorry about that. I don't know about the music, but
Okay.
that's up to the person. Okay. It'll be okay. I'm just gonna put you on hold. Okay.
Okay.
Hello.
Yes.
I've been holding. So I pulled up the contacts for the Prime Minister of Canada.
Mhm.
I have a URL link, an email address, and a telephone number, a fax number, and a postal address. Would you like me to email you this information?
Yeah, that would be great.
What's your email address?
It's COVID
Uh-huh.
truths with an S
Uh-huh.
revealed at gmail.com.
So what's after truth?
Revealed, REVEALED.
Okay. At gmail.com?
Yeah.
Okay, so that's COVID, COVID, truths with an S, TRUDHS, revealed, REVEALED.com?
Yeah.
Okay, so I'm going to be emailing the contacts for the Prime Minister of Canada.
That's great. Thank you so much. Appreciate that.
You're welcome. No worries.
You have a
Take
great
care.
day. Bye.
Thanks, you too. Bye.
So thank you for joining me. I will call back after I'm going to make another video later when I phone Justin Trudeau's office. What I'm actually wanting information on is how policies are, public policy is put into place, and if any investigations are being done. Like the World Health Organization is making claims about the coronavirus, and I'm just wondering if studies have actually been done, because as history has revealed, like in through the swine flu fraud of 1976, people are making policies in government and putting into place policy without in real true investigating. because in 1976, you can go on YouTube and find this video. There was a documentary made with starring Mike Wallace. And in that video, he interviews agents from the CDC and also government agents. And there was a pandemic announced, and vaccines were manufactured and created and there was actually no pandemic. It's actually the vaccine program put into place by government employees that created the crisis, because at least 8,000 people acquired Guillain-Barré's disease, and also thousands more were murdered as a direct result of this campaign put into place by government agents. So, yeah, I'm just concerned that there wasn't a proper investigation as to what the coronavirus is, and whether face mask covers and social distancing is actually preventing the spread of this alleged virus. Because obviously we've been lied to in the past, and there's no reason to tell me that proves otherwise, that we're being told anything other than hearsay. And also the hand sanitizers. Like, there's people making a lot of money as a result of this creation of this COVID-19, especially plexiglass manufacturers of hand sanitizers, manufacturers of the spraying agent, the decontamination agents that they're using, and also the manufacturers of the vaccines that the people in government are buying, are acquiring to administer to an unsuspecting, uneducated, illiterate population. So there you have it. If you'd like to follow me some more, I'll let you know after. I'm going to be making another call as soon as I get the information. I'm going to phone the Prime Minister's office to find out how the public policy came into place, and how somebody from government can actually dictate to the people actions that aren't, and mandate a situation that isn't actually beneficial to our psychological, emotional, and mental and physical well-being. So, anyway, thank you for joining me. Have a great day.